Hospital treatment is not limited to medicines or surgery. Many patients need support for recovery such as physiotherapy, speech therapy, occupational therapy, psychological support. These are called rehabilitation services. But if rehabilitation is not structured, recovery becomes slow, risk of disability increases, quality of life is affected. That is why NABH introduced the COP18 standard, which ensures rehabilitation services are safe, collaborative and consistent. What you will learn in this video. In this video we will understand what NABH COP18 standard says, what assessors check in rehabilitation services, common NABH non-conformities, how hospitals can become COP18 compliant. Let's begin. What is NABH COP18 standard? The COP18 standard states, rehabilitation services are provided to the patients in a safe, collaborative and consistent manner. This means hospitals must provide structured rehabilitation services, coordinated multidisciplinary care, consistent therapy protocols, to support patient recovery and functional improvement. Objective elements of COP18. COP18 includes scope of rehabilitation services, consistent rehabilitation care, collaborative care planning, adequate space and equipment, functional assessment and reassessment, infection prevention and safety practices, rehabilitation care pathways. Assessors verify these through rehabilitation records, physiotherapy notes, facility inspection. Scope of rehabilitation services. Hospitals must define the scope of rehabilitation services based on available clinical services. Examples include physiotherapy, occupational therapy, speech therapy, clinical psychology. Example, if neurology services exist, neuro-rehabilitation should also be available. Referral for advanced rehabilitation. If advanced rehabilitation services are not available, patients should be referred to specialized rehabilitation centers. Rehabilitation guidelines. Rehabilitation services must follow written SOPs, standard treatment guidelines, evidence-based clinical practices. Consistency in rehabilitation care. Hospitals must ensure rehabilitation services are provided consistently across patients. Collaborative care planning. Rehabilitation requires a multidisciplinary approach. Care planning involves treating doctor, rehabilitation therapist. Additional team members may include physiotherapist, occupational therapist, speech therapist, psychologist. Space and equipment requirements. Hospitals must ensure adequate space for rehabilitation services, availability of appropriate equipment. Equipment planning should be based on service scope, clinical guidelines. Emergency preparedness. Rehabilitation areas must have emergency resuscitation equipment, functional assessment. Before starting rehabilitation, functional assessment is mandatory. Assessment must be done using standardized assessment tools by qualified rehabilitation professionals. Results must be documented in patient records. Reassessment and progress monitoring. During therapy, periodic reassessment must be done. Purpose: evaluate patient progress. Modify treatment plan if required. Modification of therapy. Based on reassessment, rehabilitation plans should be updated. Infection prevention and safety. Rehabilitation services must follow infection control practices, safety protocols. Example, prevent burns during hot wax therapy. Staff must be trained in infection control, patient safety practices. Rehabilitation care pathways. Advanced hospitals develop rehabilitation care pathways. These pathways provide structured treatment plans, are based on evidence-based practices, are periodically reviewed and updated. Common NABH non-conformities in COP18. Common observations include rehabilitation SOP not available, functional assessment not documented, rehabilitation care plan missing, reassessment documentation incomplete, inadequate rehabilitation equipment. Hospitals must address these gaps to avoid NABH non-conformities. How hospitals can become COP18 compliant. Hospitals can comply with COP18 by developing rehabilitation SOPs, implementing functional assessment tools, ensuring multidisciplinary care planning, providing adequate space and equipment, improving rehabilitation documentation. These steps help hospitals effectively comply with NABH COP18 standards. In the next video of this NABH training series, we will discuss COP19. Nutritional therapy is provided to patients consistently and collaboratively. If you want to learn NABH standard step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.